Mm-hmm.
Okay, so infant feeding and weaning. And remind me, who's a nutritionalist? One of you, one or two.
Adriana.
Right, so you're leading this session. Excellent. Over to you.
No pressure, Adriana.
And I put up on the YouTube today the interview I did yesterday with Jill Rapley, who is the author of the Baby-Led Weaning book, which is very, very popular. So that interview's up there. I do encourage you to go and see it. It's very interesting. So today we're going to look at how combination feeding can be supported. And combination feeding means breastfeeding and feeding formula from a bottle. So many, many mums do this, large majority of mums do this. So how we can support that best. We'll look about weaning onto solid food, because although generally the maternity nurse will have left by then, it may be that the parents are asking you about it, or you're still there at 4 months and they're going, right, let's start 4 months. So we need to learn about that, because it's important for that stage or just a little more. And we'll look at different approaches. So when parents have decided to wean, how we can support them to do so safely and effectively, and to do a bit of myth busting. So the first activity, I made a change on this on my other computer, not on this one. Right, for children under 6 months old, let's as a group list all of the ways that they can be fed. So there are not just 2 ways to feed a child under 6 months, there are loads. So what are the different ways that babies can feed? And we're talking under 6 months.
Exclusively breastfed.
So that means having breast milk only from the breast. That there's nothing else happening, nothing in between. It's baby right on the boob.
How about exclusively breastfed from another woman?
Yeah.
So wet nursing.
Do you call it doula? Do you call it doula?
No, we call that wet nurse.
Oh, wet nurse, sorry. Yeah, I missed it.
Exclusively donor. So donor breast milk can either be directly from a woman, as in from her breasts, which is a wet nurse, or it can be donated and fed in a bottle. So there's the 2 options there.
So pumped from a donor as well.
So it's a different computer now as well, and I'm struggling with how the keyboard works and everything. Okay, wet nurse or pumped, and we do have wet nurses still in the UK. It's not something that is widely talked about. It's something that is often quite hidden. It's something that often women don't feel is kind of acceptable, because it's not something that is widely practiced, but it is still absolutely around. And the more you talk to women, the more you'll find that they do, either occasionally from, oh God, I had to leave my baby for the evening, so my friend came over and she boobed him, because she's still breastfeeding her own child, through to women who've made a conscious decision, I've had a cancer diagnosis and I can't feed my child, I'm going to work with someone to feed them. And then in between that is that donor milk idea, where either it's donor milk through the hospital, so women pump and they give it to a hospital, who then pasteurizes it, and it's then given to babies that way, or it is through a milk bank, which can be again donor milk but pasteurized and health tested, or it can be donor milk which is through websites like Human Milks for Human Babies, which is where it's absolutely done on trust. So you say, I'd like my baby needs milk and I'm in Cambridge, and someone else goes, oh, I'm near Cambridge, and you make a decision between the 2 of you that you're going to share that. But that isn't necessarily something that is tested. You have to go on what people choose to share. Jana, you had a question or a point to make?
I just would like to ask, how do you search for these wet nurses? Is it some forum or some?
So Human Milk for Human Babies with a number 4 is probably the most well-known donor milk site, and that will include women who are wet nursing, as well as women who are donating milk that has been pumped. Often it is very much through word of mouth. It's joining a La Leche League group, or talking to other local mums and finding out that someone does. It's not advertised like in a professional way at all. And something as a maternity nurse that you need to be really clear on is that it's not your place to recommend that a woman does that or to facilitate it, because if a woman is giving her baby someone else's milk, either directly from the breast or from a donor, and it's not gone via a legal milk bank which has checked pasteurization and HIV, then although it's illegal, it is a legal thing to do. If you facilitated it and that baby turned out to get an infection because mum was HIV positive, say, you'll spend a long time in the court. So it's something, if mum is interested in, you would signpost and say, it is a thing. Here is a website where you can find out more, but then she must be the one who actually does that looking. Yeah, you shouldn't be the one that goes, I will find you someone. My friend Adriana said she will do this. You've got to steer away from that, and really just say, well, it's absolutely a thing, and I can support you emotionally, but practically you need to be the one to do the looking. Sure. When you're using a milk bank though, so it's donor milk through a route where the hospital or the milk bank has done the thorough checks, that is something you can facilitate or go and pick up, because someone else has taken responsibility for that milk, the checking process, the infection process. Okay, how else could a baby be fed?
With formula.
Absolutely. Okay, anything else for a baby under 6 months? What else might a baby be having under 6 months? And let's think of reality rather than just the rules.
That combination, yeah.
Yep. Mm-hmm.
Probably for most babies at that age, they would have already started weaning. So
yeah.
Any kind of solids that parents
may
choose
well
to give
be
them.
having solid food, and we'll talk about that over the course of today. And thinking about that's what might go into them. How might it get in there? So obviously breastfeeding is directly from the breast.
Yeah.
But the bottle is, yeah. How else could they be fed?
I've seen a syringe as well being used.
Mm-hmm.
I don't know about anything else.
Anyone else got a good idea of what else can be used to feed a baby?
Can they do the beaker?
Yeah. Certainly from around 4 months, that would be appropriate. And you can actually do cup feeding for very tiny infants. And we're talking about a cup. Do you know a vodka shot cup? Yeah. That size. That sort of size, often made of plastic, that you can actually cup feed a baby if you don't want them to use a bottle, but that's only for very tiny babies. Same with a syringe. It's something we only use for very tiny babies. Mm-hmm. Anyone else know anything else?
How about that pipe you mentioned that goes around your breast?
Yep. SNS, well remembered. Supplementary. There's a delay on this. This is really weird. I'm typing, but I can't see it come up. Okay, yep, a supplementary nursing system which could contain breast milk or could contain formula.
And a spoon, of course. Spoon.
Yeah, absolutely. So you can use a spoon to feed all sorts of things. So I'm wondering where Maria is. I'm going to give her a text in a moment. But if we click on to the answers, as it were, that one hadn't changed from my old computer. So exclusively breastfed, we said pumped breast milk from the donor, from the mother. You could use a syringe, a cup, a supplementary nursing system, or a bottle. In terms of infant formula, we're hoping that they're going to have stage 1 formula, because that's best for almost all babies. Parents could choose to use a comfort formula, anti-reflux, or they may be suggested to use a formula for medical purposes if they have an allergy. The doctor might say then let's use something to support that cow's milk protein allergy. or they may be weaned onto solid food, generally which is pureed, early. And any of those can be in combination. So, in the UK, there was an infant feeding survey that was carried out annually until 10 years ago when the money stopped, so they stopped doing it, unfortunately. So these figures are 10 years out of date. It will be different now, but this is the best we've got. So 81% of women starting to breastfeed, and that is very similar now. I know that because hospitals produce these figures still. And breastfeeding initiation, all that means is that once, maybe in that golden hour straight after the birth, the mother put the baby to the breast. If they never did it again, it would still be within that 81%. And of course, that also counts women who have breastfed their babies for several weeks or carried on. So there's a big difference. Breastfeeding initiation counts everything from baby was at the breast once and never again, through till breastfeeding was initiated and continued for 3 years. And exclusive breastfeeding. So this means exclusive breast milk. It doesn't mean only at the breast, but it means only breast milk rather than formula. So at 6 weeks, around a quarter of women are still exclusively breastfeeding. And remembering that the World Health Organization recommendation is to exclusively breastfeed for 6 months. But here in the UK, we're only managing about a quarter breastfeeding at 6 weeks. It then goes down 3 months to 17%, 4 months, 12%. And we still think around 6 months. So when the World Health Organization is suggesting their recommendation is to do this, only 1% of women are still doing that at 6 months. So really, really tiny figures. Ghana, 97%. That is ridiculously different across the world. The Netherlands is much higher in the 60s and 70s. So there are huge differences across the world, which tell us that it's absolutely nothing to do with boobs. It's not that women in the Netherlands or in Ghana have better breasts that work better. You know, it's not physiology. It's all about support and cultural expectation. That's the reasons here. So any breastfeeding, so that's mother's combination feeding at 6 weeks was 55%, which is why we're going to spend some time on it today, because 6 weeks you're going to be a maternity nurse in there generally at that time. The majority of mothers will be part breastfeeding and part formula feeding. So what we'll look into today is how to support that relationship, because it's very important that, you know, you're giving those mothers as much support as possible. And again, at 6 months, still any breastfeeding, so combination feeding, is about a third. So that's a much bigger figure, that still there's some breast milk going into those babies. And the reason that's a good thing is because any breast milk does good. The less breast milk a baby has, the more basically the more concentrated it is in terms of nutrients. So we know when we've looked at breast milk of women who are feeding 2-year-olds, so 2-year-olds are still mostly eating real food, but if they are still breastfed some of the time, that breast milk is a lot more concentrated in terms of the immune factors and the nutritional factors than the breast milk of a 4-month-old, because the 4-month-old is having more volume. Because the 2-year-old is having less volume, the breast milk, basically the body goes, oh, you're not having so much, I'll pack it in. A bit like you could choose to have 5 weak cappuccinos through the day, or you could have a double espresso and nothing else. You know, I may get my amounts a little wrong, but you might be having the same amount of coffee over a double espresso or 5 weak cappuccinos. And that's a bit like the breast milk. If you're having only one coffee a day and you're packing it full, that's the same as the breastfeeding less. So for these 6-month-olds, we can guess it's the same as at 2 years, that if they're only having a little bit of breast milk, it's still very concentrated in terms of the positive factors. So it really is a case of every drop counts. And from the survey, around half of the mums 10 years ago, when they prepared their infant formula, had done so according to the guidelines that we learnt in level 3. That water over 70 degrees, making it the formula up straight away, not leaving it in the fridge, about half of women. And 10 years ago, around a third of mums had introduced solids by 4 months, and 75% had done it by 5 months. The guidelines around when to start solid feeding changed 18 years ago. So even 8 years after the guidelines had changed from 4 to 6 months to around 6 months in the UK, 8 years later, a third of mums were still going for 4 months, and 75%, the majority of mums, were feeding around 5 months. So feeding early is a really big cultural thing here in the UK. Tell me what it's like in the countries where you've supported. Is that a similar situation or a different situation?
I'm in the UK, so
Yeah.
it's the same. I've seen them start at 4 months and at 6 months as well, but I've never seen them start earlier than 4 months. I know some people in the past have done so.
It is very rare now to start earlier than 4
Yeah.
months, yes.
Yeah, about 6 months.
Jan, is that your experience as well, that women tend to wait for 6 months?
Not really. Women usually started at 4 months.
Okay. So once we go on today, we'll find out about why the reasons might be and what the reasons might be to wait. So thinking about that combination feeding of over half of mums are going to be doing this by 6 weeks and a third at 6 months. To provide support for this, we need to understand what the mother thinks and feels and what she wants. This is not about what we want or what we think is best for baby. It's about what she wants and what she thinks is best for her baby. We need to understand how lactation works so that we can best support her, because if she's choosing to part breastfeed, we need to make sure we give her the right information so that she can keep going with her choice. And also, we do need to consider the needs of the baby and what they need for healthy and safe digestion. So when we looked back at that infant feeding survey over many years, it was very clear that the reason most mothers stopped was around lack of support. So most mothers stopped breastfeeding before they wanted to. So this isn't about saying women are saying in the majority, I chose to breastfeed for 4 weeks and I wanted to stop, so I went to formula feeding. That's a much less likely scenario than women saying, I want to feed, but it hasn't really worked for me, or it's difficult, or I'm unsupported, or it's painful, or something else is going wrong, which means that I choose to change to formula or to add formula in. But we know for about 80% of those women, so vast majority of women, they actually wanted to exclusively breastfeed for longer. So it's quite a myth to say that formula feeding and breastfeeding are equal and that it's, it's just a choice of either or choice of both. Actually, what we see when we speak to women is we find the majority did want to breastfeed or breastfeed for longer, but for a variety of reasons, that didn't happen. So that can be quite an emotional thing for women to cope with. And what we often see, especially on the internet, is don't worry, your baby was fed. The fed's the most important thing, or the awful phrase, fed is best. And what that is saying to women is, it's fine to give your baby formula, and it doesn't matter how you feel about it. And the first part of that sentence is true. It is fine to give babies formula. But it isn't true that that doesn't impact on a mother if she has, as we know, 80% of women wanted to do something and has had to change her plan. A bit like if we say about that to a woman who's had an emergency cesarean, it's fine, you've just got a healthy baby. It neglects that idea that actually she'd planned a certain type of birth that she wanted. She's now got an emergency cesarean scar, which means for 6 weeks she's going to be pretty incapacitated. She's got, she's had emergency surgery, she's had drugs, she's had a different environment, she's not able to walk around or, go to the loo very easily. So, oh, you've got a healthy baby. Absolutely, that is true, but it isn't the only thing that matters. So this emotional support for women who are combination feeding or stopping breastfeeding before they have chosen to is really important. And with almost anything else, if it goes wrong with your body, medics try and fix it. When I broke my arm, they didn't just say, oh, well, never mind, you've got another arm. they, put it in a sling and then they did an operation. If you have a stomach, a severe stomach upset, they're not just like, oh, well, food's not that great, you'll be fine, we'll drip feed you instead. They try and sort out what's wrong with your stomach. But for breastfeeding, when breastfeeding is not going well, the medical solution is generally give formula. It's not let's try and help fix it. It's you can have formula instead, which is just like saying, well, you've lost an arm. I'll give you a prosthetic arm. That will be completely the same. It's not, is it? So we know that women who stop breastfeeding early are likely to have had less breastfeeding education antenatally. So likely to not have that journey talked through and potential problems talked through before they even get to having a baby. We know that they're likely to not have had enough support for lactation. And it's unlikely to be a purely physical issue. Physical issues, we think, are around 4% of women. And things like PCOS, which is polycystic ovary syndrome, or having breast surgery, or thyroid or glandular issues, they don't always, but they can impact on breastfeeding. And some babies have a physiological issue, like a tongue tie, which means they can't get the milk out as effectively. So there are some situations where boob and baby are not working well together, but it's not the amount of situations that actually end up with 80% of women not meeting their breastfeeding goals, because 80% of women and babies are not broken. Adriana.
Some women have the best intentions to feed, as you're saying, for a prolonged period of time. Some women try for one day and then they just turn it down, and from the next day onwards they do it. Otherwise, they do take a pill to stop producing the milk. What is the pill called?
Domperidone in the UK, but that is prescribed off license, which in the UK means that this is a pill that we use for something else, and it is not licensed for use for stopping breastfeeding. It does that.
So it's not licensed.
It's not licensed. So a GP in the UK is allowed to prescribe a medication for a different reason, if they think that it's going to help. But if it's off license, it means it hasn't been fully tested, and the UK authorities haven't said, yes, this is definitely safe. So if something goes wrong, the doctor could then be sued.
Mm-hmm. Is it just one pill they take? Just one pill?
No, it tends to be a series
of pills.
So some GPs will prescribe, but others won't, and it is very much that person's decision, because they're the one carrying the problem if something goes wrong.
Caroline, can I ask you to type it in the chat just so I see? Thank you.
Yeah.
Thank you.
And anecdotally, and this is not something that you should suggest to a woman, but you might say, this is a thing, is that the medication in Sudafed, which is a cold remedy, can have a negative impact on breastfeeding, i.e. it can dry out breast milk. So women who are wanting to breastfeed should definitely avoid some over-the-counter cold medicines, because it can have a negative effect. Having that information means a woman who wants to stop breastfeeding may choose to take that medication herself, because it may well have a positive effect on stopping the breast milk. But again, it's not your job to say you should do that, because if the woman got sick because of it, she's taking a medication for a reason other than is on the packet, you would get sued. Okay, let me find the chat on here because it's all on a different screen. Hang on.
It's just below, underneath.
No, I can't. I know where it is on Zoom, but on this computer, Zoom isn't showing properly because it's on a different. I've got a big screen and I've got my screen underneath on my laptop, and it's in two different places, and it's really confusing.
I actually come across to some ladies who decided to take these pills.
Yeah. What have your experiences been?
They just said they just didn't want to breastfeed their babies. That was their choice.
Thank you, Caroline.
Yes.
So the first one is the medication that a GP might choose to give. The second one is over the counter. It's a cough and cold medication, which you definitely should say to a breastfeeding woman who wants to breastfeed, this is not a good idea. So other women may choose to use that information in a different way and use it to stop.
Thank you very much.
Well, okay, so many women who say, like you said, that example of they'll try for a day and stop. It's important that we don't put any blame onto that woman.
Yeah, there's their personal decision, isn't it?
It is, but what we need to understand is a personal decision may not always be an informed decision. And our job is not to make choices for women, but to help them be informed. So that woman often will have had not much breastfeeding information, so she won't know that, for example, on the first day, she's only going to produce maybe drops of colostrum, and that baby needs to be on the boob all the time, because imagine a plant that you put a piece of string into when you go on holiday, and the string goes into a cup of water, and it goes drip, drip, drip. Does that plant get fed? Yes. That is how a baby has colostrum, because they're coming out of that fourth trimester. They've expected their nutrition drip, drip, drip through the umbilical cord. So they come to the boob and they're expecting drip, a drop every few minutes for 24 hours. But if the woman does not know that, she'll think, I fed my baby for 20 to 40 minutes. That's enough. My baby's upset. I don't have enough milk. I don't want my baby to be upset. I'm going to give formula. And it's not about her being in the wrong. It's her not having the information about what is really happening with her breasts and her baby. So where the blame lies is with the lack of education, and then the lack of support from staff, particularly at that point midwifery staff, to say, this is normal, this is what you can do, this is how we will support you, and this is how, this is when things will change. You're right, many people are like, I've just had 36 hours, in labour. My baby's crying. I can't stop them because my breasts aren't producing any milk yet. Give the baby formula and then they're going to stop crying. And then my baby stopped crying, and, that's what I want as a mother. But it comes down to that lack of education. Jana.
Are they not all mothers, pregnant women, they are not having this kind of information from the midwives or from anybody?
In the UK, there is a large proportion of women who will choose to go for private antenatal classes. And those antenatal classes generally will have 1 to 2 hours on infant feeding.
That's not enough.
If you go to an NHS pregnancy course, generally that's 6 hours over 1 day. And they, again, might spend half an hour to an hour on infant feeding. Now what did we spend? 2 hours just on breastfeeding, in our level 3 course.
Yes.
And I packed in a lot of information into that. But even that, we went away saying there is so much more to learn. That's an absolute whistle-stop tour. If you have just that, and then you have a 36-hour labour, and then you have a screaming baby, even that short amount of information isn't enough. Because what we also need is a society where women see women breastfeeding and women talk about women breastfeeding. And so by the time you've got your baby, you've talked to 20 of your friends who go, yeah, these first days are really tough and this is how to get through it. But because we don't have that, it's not just the taught education, it's the societal education. We don't teach it in schools. But not all women attend antenatal education. They either can't or choose not to go private, or the midwifery ones at the NHS are full, or they're on a day when they cannot get there. So there are significant amounts of women whose only breastfeeding education will be maybe 10 minutes talking to a midwife. So it is really variable. What we want ideally is from school just as we teach people about how the heart works and how blood travels around the system, we start then to teach everybody, boys and girls, how breast milk is made, because 50% of the room, you know, have the capacity to do this, but we don't teach it. We teach how sperm is made, and only 50% of the room have that, but we don't teach how breast milk is made. We need to start in school and keep those conversations going all the way through, so that the first time a woman learns this is not when she's 36 weeks pregnant, because actually by then it's probably too late. So helping women understand, that woman who's fed for a day, that it's not her that's failed and it's not her body that's failed, it's the support system is really important in supporting their mental well-being. And a good book both for you to read and for you to recommend to your clients when they are if they are having these feelings, is Why Breastfeeding, Grief and Trauma Matter. Because that, and it is often on internet forums, that oh, it's fine, just keep the baby fed, that's all that matters, doesn't acknowledge the journey that these women are going through when they've made a choice or they've made a plan and they're not supported in that choice or that plan. So it's not about blaming mums, it's about looking to where, you know, what came through, what society came through. So that's around the emotional support. We also need to understand, if women are combination feeding, how that lactation works. And obviously you've got module 2 of the level 3 to refer back to, because we need to know how that supply and demand system works, so that we can help those mums to meet their own goals. If they're wanting to combination feed and they want to continue breastfeeding, they need to know that milk production is higher at night. So if they're choosing to combination feed by breastfeeding through the day and letting the maternity nurse give formula at night, what is a likely outcome for them? If they're boobing at the day, but they hand baby over to you and you give formula feeds from 10 o'clock until 6 o'clock, what's the likely outcome?
Milk production is reduced greatly.
Absolutely. So if they are okay with that, and that is their informed choice, then you're okay with that, because it's their baby, their choice.
Yes.
What we don't want is to go, oh, fine, mum's made a choice for me to formula feed at night and she's going to breastfeed during the day, and to not have a conversation saying, let's talk about what the impact is on your physiology in the breast milk to make sure it's still helping you get to what you want. Adriana?
Helena, are there any instances where a woman will give up breastfeeding because of the difficulties or pain or whatever,
Yeah.
and with the support of a maternity nurse,
Relactate, we call it. Relactate. Yes. Women can lactate if they have not had a baby. So, and it's not tending to be maternity nurse support. This would tend to be lactation consultant support. So if they are adopting, or the other mum in a single sex partnership where there are 2 mums, they can lactate without having a baby. It is not easy. It takes a lot of hard work and drugs, but it can happen. Women who have had some breastfeeding and then stopped can relactate. How successful it is depends on how much work they put in, because it is very hard work, but also it depends how much they breastfed at the start. So if they actually breastfed for 2 or 3 weeks quite successfully, and baby was having all of their milk from the breast, and then they stopped, maybe they went into hospital for cancer treatment, there is a reasonable potential that they can get that breast supply back, because that first 2 weeks, remember, is when the milk supply ramps up. If they tried for 1 day and then they're trying 6 weeks later, this is going to be a very, very difficult journey, because their milk, they've never opened up those receptors, those prolactin receptors through baby sucking that happens in those first few days. When their milk changed from colostrum to mature milk at day 3 to 5, and it became a supply and demand system, there was never any demand. So their body was never told, make milk. So yes, it's possible, and it depends on the amount of work they put in and how much and how successful and how long breastfeeding was at the beginning. If a mum has had more than a few days off, as it were, the best thing to do in that circumstance is to have the support of a lactation consultant, because they will work on both pumping, latching baby, and potentially galactagogues, which are herbs which can help improve milk supply, or potentially medications which can help improve milk supply. All of those things as a big package to support that mum to relactate. So relactation, unless you have other qualifications, is generally outside the scope of a maternity nurse. It will be, I can help you, and I'm going to help you by pointing you to someone who knows more.
And that would be the lactating professional.
Lactation consultant, yeah. And remembering that that title, IBCLC, International Board Certified Lactation Consultant, means you know you've got someone with training. Just lactation consultant means it could be someone who did a midwifery degree 30 years ago and has not done any training since, and the science has changed. So if you look for IBCLC, that's the lactation consultant who has had significant additional training and has to do an exam every 5 years, a 3-hour exam, to say that they are updating.
The reason why I'm asking is, so let's say as my future client contacts me and books me in 3 months prior to giving a birth to their baby.
Yeah.
So I'm not a lactating consultant, I'm just a maternity nurse, but surely enough that when a mother gives a birth and I am there with her to support her breastfeeding, her not having enough of information means that I have to put quite a lot of energy.
But that's not relactation.
That's not
That's
relactation.
not relactation.
No, that's not relactation. Just
that is absolutely your role, to share what you know. Yeah, that general lactation support.
Yes, but you said that normally, imagine a woman has no, one of those videos we watched, the lady said that every woman is almost always prepared for the birth and soon after.
Yes, Carmel, yes.
Breastfeeding, yes.
Yeah.
And so less likely she will be. And then I will come in and I will have that maybe first 2 hours and I will go crazy with all my knowledge and being sitting in my head to be explaining it all. Would that then be maybe more amicable of me or professional of me, maybe a week prior to her giving a birth, or I don't interfere at all?
Well, this is about what your client wants. And what I did, if you, in interview, you absolutely should be asking about how that woman intends to feed her baby, because you need to know what your expectations are. And if she's saying that she'd like to breastfeed, that's when you open up the conversation. That's fantastic. I love supporting breastfeeding mums. What education are you having around that? Oh, I went to an NCT course. Brilliant. Can I recommend that you also do this? So you can, at the interview and those first few conversations when she is engaging your services, so when she says, yes, I'd like to go ahead, then you're going, wonderful. I know we spoke at interview about breastfeeding. Can I give you some, here are some suggestions of great courses that I can recommend to you, or websites that are really good that my clients have found helpful in the past. Is this something that you'd like some support on antenatally? Because we can always have a couple of hour session on Zoom or in person, depending on where you are. Well, we can talk through so that we're both as prepared as can be. It's up to the mother whether she thinks that's what she needs, whether she thinks she's getting education elsewhere, or whether it just hits in her head and goes, I should do that, but I'm going to do it my way.
Mm-hmm. Wonderful. Thank you so much.
And then if you get there and you find actually there are gaps, you putting 2 hours of knowledge onto a 36-hour labour mum is not going to work. So it's that drip feeding of, oh, it's so wonderful you're doing this. You know, should we try this next time because that could help? Or it's so wonderful that this is happening. Would you like me to, video the latch so that you can share with your midwife so that you can improve it? If you know that that latch is not good, you say, you're not saying the latch is crap. You're saying, well, I know the midwife's coming later. Shall I video the latch in case baby doesn't feed when the midwife's here so that we can share it? Mm-hmm. So you're making sure that she will get that support without saying it's not going well, because you don't want to undermine, but you're drip, drip, drip feeding rather than splurge.
Mm. And this you said lasts a day or 2 or 3 days, that drip feeding?
I meant drip feeding as in your information. But in terms of colostrum, colostrum is produced in small amounts over the first day and it rapidly increases.
So just one day she has to.
1 to 2 days, but baby will be on the breast a lot for those first few days, because remember, they have to open up those prolactin receptors. So the more sucking they're doing, the more they are preparing the milk supply.
Thank you.
So we know that milk production is generally established by 6 weeks. So after that, it's about maintaining supply, not increasing. But if mum has combination fed before 6 weeks, that means that her milk supply is not as high as it could be. So if she wants to change the balance to more breastfeeding, we will have to support to increase supply. And after 6 weeks, actually the IBCLC is probably going to be needed, because the body at that point has gone, oh right, 6 weeks, you're good there, that's what you need. Whereas up until 6 weeks, the body is in a phase where it knows it can be changing. It's still adjusting to the baby, which might be too much, might be too little. After about 6 weeks, the body's gone, oh yeah, you're good, that's what you need. So we actually need then to have that additional support if you want changes to be made. And to remember, remind the mum that even small amounts of milk are beneficial. So the less it receives, the more concentrated it is. And a teaspoon of breast milk contains around 3 million germ-killing cells. So if mum's doing, oh, I'm only doing 1 feed a day, what is the point? The point is that actually she's still supporting her baby with these 3 million germ-killing cells per teaspoon. It's her choice if she wants to stop or not, but that's important information for her to help her make that choice. And then if you've got a mum who is having your support because she's returning to work early, or she's working from home, so she's away from baby, working, then she will need to pump to maintain her supply. And again, that's the same thing. If she wants overnight, if you're having baby all overnight, that's absolutely fine, but her supply will decrease unless she pumps at least once or twice during the night. So we've had the emotional support for the woman, and then we need to give her the information to make sure that she's making decisions that are not going to have an impact further down the line that she didn't expect. Because the relatives who say, oh, just give him a bottle, just one, don't realise that this does have an impact on the baby. So she needs to know and make those choices that are right for her. And then the next part of this is around supporting that baby, because the baby is important too. So for a baby who's being combination fed, a baby who's having breast and bottle, we need to use that paced feeding technique, because we used to think that babies had nipple confusion, that they were like, what is this breast and what is this bottle? This is confusing, because they looked different or they tasted different. Actually, what we know now is it's much more about the flow of milk that is the problem or the change, not so much about the nipple or the teat itself. So paced feeding for breastfed babies is super important, so that we're mimicking what happens at the breast and making for an easy transition back. We're not giving the baby that easy ride of glug, 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 and then I go back to the breast, hang on, I have to work at this. This is expending energy, cry, 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 and then we've got into a negative cycle. So lots and lots and lots of marketing will tell you that so-and-so type of bottle is closer to the breast. It's all rubbish. It's all just marketing. If you go to someone who does not have something to sell, so a lactation consultant who is not selling you anything, they will generally say, if you're wanting to try a bottle with your baby and it's a breastfed baby, try a cheaper brand, try an own brand with and these are pictures of what I'm saying, a medium base teat with a short to medium nipple length, something like silicone, and that often works well. So there are 3 factors to this. We're not trying to get something that looks like a boob, because breast tissue compresses, whereas the silicone in bottles does not compress in the same way. For a baby to feed on the breast, they need to have a large amount of breast tissue in their mouth, or else the breast milk doesn't come out. With a silicone nipple, that is simply not the case. It drips out whatever. So the ones that say they're closer to nature and they have those very wide, they have the nipple in a very wide thing because it looks like a breast, actually don't help the baby to latch. Let me get my bottle. Hang on. Okay, so here, the baby, if they're breastfed, would be taking in this. Can you see where my fingers are?
Yes.
But the baby isn't going to do this on a bottle. What it's actually going to do is slip to there, because this is not breast tissue. That doesn't compress. So it cannot have a breast-like latch. It has to have a latch here.
Yes.
So although it might look more like a breast than the ones that are on my screen, it actually doesn't support it. But of course they're going to say this is closer to a breast because they are trying to sell bottles. So if it says it and it's trying to sell you it, question it. Some mums may think that the nipple shape, they're like, oh, well, it needs to be certain thing to look like my nipple. It needs to be one of those ones that is kind of like a lipstick. And actually what we know is that often for babies, a short to medium length nipple and silicone rather than latex compresses very easily. So again, you're going to have something in the baby's mouth that's doing this, which is not what a nipple is doing. So start cheap and see if that works for the baby. And if it doesn't, you can try something else, but there is no one best bottle. So when you go on maternity nurse forums and you'll have people ask the question about once every 3 months, which is the bottle you recommend to mums? And my answer is, why are you recommending one thing? Because baby Jane is different from baby John. And they have different mouths and different preferences, and their mums have different boobs. So when maternity nurses go, well, this is my favourite bottle, that just means that they've been suckered in by the marketing rather than they actually have looked at each individual baby and seen what works for them.
Caroline, are there any different sizes of the teat?
Yes, there are different sizes of everything. And there's also different holes. So on here, you won't be able to see it, but this has a number 1, which means there's one small hole here. And then you have 2 and 3, which means that the flow is faster, that milk will drip out faster. It's basically got a bigger or more holes. So we generally start with a flow 1 and keep with a flow 1 for a breastfed baby, because we're not trying to increase in the same way that a formula fed baby, the amount of milk they have increases so much over time. They do need to move up the flow preference, because or else it would take them an hour to have that amount. But with a breastfed baby, often we want that slower experience, so we might keep with a 1, or when they're a little older, a 2.
So it refers to the number of holes, not to the size of a teat.
No, the number refers either to the number or the size of the hole. So it's either more holes or a bigger hole. It depends on the brand. It does not refer to the size of this bit.
Yeah.
That's simply by eye. But yeah, all the marketing will tell you it's closer to the breast, and it's all rubbish.
Okay.
There's a link on the bottom here. Can you see that on the green?
Yes.
And that link, we'll go to it now, but this is a really good one to share. When a mum says to you, which bottle do you recommend? I would love it if you didn't say, I recommend brand X. It always works for my babies, because they're not your babies for a start. And they're definitely not all the same. I'd say, well, why don't we go and have a look at some information together so that you can make a choice that's right for you. And this page is a really good one for actually getting that information. So let me share it with you now. And I've got to stop that share. I hate having 2 screens. This is really weird.
It's only for today, isn't it?
I hope so. Because it's because of the fireworks. There we go. Right, can you see?
Yes.
Yes.
Okay. So this is a really good piece. This website is very well respected, and look who it's by. It's by an IBCLC. It's by someone with a qualification that's renewed every 5 years. So she says there's a vast selection on the high street. Many of them claim to be closer to breastfeeding, or it's the rate of flow, or it's soft, or it's something about how they work. And basically, most of the claims have very little research and are just to increase sales, because bottle manufacturers would like to sell more bottles. There is no single best bottle for breastfeeding, and we can't rely on advertising, but there are certain things that seem to help babies. So the article then goes down and it discusses, these are all different shapes, it discusses the different things that you might need to consider. So it discusses about wide and short and thin. So have a look through, and when your mum's read these, she can then make a decision that's right for her to try. So it goes through things like bottles with many parts need more cleaning. And if they need more cleaning, it means there's more likely that they can spread infection. So simpler bottles are less likely to, give babies infections. It talks about having a material that's not too hard, but also won't collapse in the mouth, like, these ones can do. We have allergies discussed. So mum needs to consider about allergies. So this is a really good article. It's on there, and it's good to actually go through so that parents are making their decision rather than relying on you to tell them something, which is basically you're then working for free for Tommy Tippy or Avon Phillips or whichever brand. You're giving marketing for them for free, and they're not going to pay you.
Caroline, and if there is a premature baby, let's say 5 weeks premature baby, would that be the same size, or other?
Home babies will, if they are having milk from a bottle, often the hospital will supply smaller, often made by NUK teats, which are shaped, and they're going to support the baby to latch in a slightly different way because of the size of their mouth.
Yeah.
So often babies will come home with a teat preference from that having been introduced at the hospital. But once they become term size, so they're the size of a newborn baby, mums can choose to carry on with that, or they can choose to make a change.
What is the name of that? The NUK?
Well, the brand name is NUK. It's not the only one, but that's often one that hospitals use for their preemie babies, because they make a physically smaller teat. And then when we're also supporting this baby who's being combination fed, we need to remind the mum and remember that a fully breastfed baby, the amount of milk wouldn't change very much from 6 weeks to 6 months. But we can have a guide from that of roughly what we think a breastfed baby might have. We don't measure it, and we can't measure it, but this is a guideline. So when she's thinking about how much milk should I leave if I'm expressing, or then this would be your guide. So we're thinking somewhere of about 750 mils a day. Could be as low as 570, it could be as high as 900. So you divide the amount of feeds a baby normally has in 24 hours and say, well, this is one of those feeds. I'll have, if it's 8 feeds, I'll have 1/8 of that, and I'll see if the baby wants this. But if you're using paced feeding, what you're doing all the way through that feed is saying, baby, do you want more? Baby, is that enough? So you're looking at the baby for those cues. When you're calculating how much formula to give, you're looking at that overall daily amount of formula for the age of the baby, divide it by how many feeds are indicated for that age, and then you're going to say, okay, well, this is my guess of what you want when you're having a formula feed. But again, looking at paced feeding to make sure that the baby is telling you whether it's too much or too little. Usually we don't suggest mixing breast and formula in one bottle. And it's not because there's anything wrong with it in terms of the milk, it's in terms of wastage. Because if you've mixed a bottle of breast and formula milk and baby is paced feeding and they only have 3/4, you've wasted some of that breast milk that has been pumped. And pumping is a big deal. It's a lot of work. So the reason we don't suggest mixing is so that when mum has done a job of work, that milk is not wasted. It's definitely used. And as soon as you mix formula up, okay, if you don't use it, it's a few pence worth, but you can buy some more easily. Yeah. When you've pumped it, it's not just a case of, oh, well, I'll just pump again, because that's another 40 minutes out of your life. So we do encourage women to feed the breast milk first and then the formula, so that the breast milk is the first thing the baby's having, because that's the thing we want them to have more than the formula. If there's a choice, the breast milk is going to be better for that baby. And then we'll then put formula in the bottle and continue the feed, or in the new bottle, sorry, and continue the feed, because we're not going to waste any of the breast milk that has been expressed. Anything that says you must introduce a bottle to a baby by a certain age is not based in research. There is no magic age where a baby, if they've missed the boat and haven't had a bottle, will never take one. Some babies will not take a bottle if it's introduced later. Fact. But we don't know which ones it is. So there isn't a you must do it by this age, because we don't know which babies that is and which it isn't. So it's about thinking, talking to mum and saying, well, what are her goals? How important is this to her? If actually she's not planning on going back to work until after 6 months and she's planning to mostly breastfeed, then introducing a bottle just in case, why is there just in case? Because after about 4 months, we could cup feed that baby anyway, so that baby doesn't need a bottle ever. We could formula feed in a cup. So it's about understanding that mum's goals. If that mum is going back to work at 8 weeks and she knows her baby is going to have to be fed during her time away, then yeah, we're going to focus on making sure that a bottle is working for that baby early, because in 8 weeks' time, there isn't another option. And we don't want mum to be stressing, so we do want that to be in earlier. In general, we try to keep the baby fully breastfed at the breast for the first 6 weeks or so that we introduce a bottle after breastfeeding has become established, because the breastfeeding is what we need to work more than the formula feeding, because we have other options with formula feeding. So there isn't anything of you must do it before 4 weeks. In fact, the guidance would be to do it after 6 weeks. And absolutely, if your mum has never given their baby a bottle and they're 8 months old, they may not take a bottle, but that's not a big deal, as they can then take a cup. So it's really about understanding what the mum's goals are, what her needs are, and then making a plan based on her goals and needs, not on a rule. It is important to know, though, that if the baby is taking 500 ml of formula or more, they don't need additional vitamin D, because that vitamin D is in the formula. So we don't want to overdose them. If a baby is not taking 500 ml of formula a day, or it's not taking any formula, the UK guidance is to recommend a vitamin D dose, because basically most of us in the UK are vitamin D deficient. So the mum can't pass it on to the baby if the mum is deficient. The NHS guidance is to give the baby the drops. An alternate approach is to what mum call high dose mum, so that mum has excess vitamin D and that gets through to the baby. So there is a website that talks about that if that's something your mum's interested in. A quick Google will help you. It's on Kelly Mom. So high dosing vitamin D is something to be aware of, but if baby's having 500 ml or more formula, that does not need any additional vitamin D. When you are supporting a mum who would like to introduce a bottle at whatever age for whatever reason, and it's not going immediately well, this is a list of things that you can try. So getting the hormones flowing, getting mum calm and patient so that she's in the right place. So not trying it when she's stressed because she has to go for an appointment in half an hour, because we want her to be calm so that the baby picks up on these emotions that are calm. We can try different things, because we don't know whether baby Jane is going to be the same as baby John. So we've got completely opposite things we can try, and that's okay. We can try being skin to skin, like breastfeeding and just holding a bottle. And some babies will love that. Some babies will hate that. And we need to do fully clothed, sitting upright, completely different. So encourage mum to try different things. Try a different position, try a different place, try a different person. You're perfect for this as a maternity nurse. And try mum in the room, try mum out of the room, try mum out of the house. So we're just doing these. There's no one way. We're going to find out what works for this baby. Generally, we're not going to try bottle feeding a baby who's not used to it when they are really hungry or when they're really full after a breastfeed. If they're really hungry and it's not working well, they're just going to cry, and that's going to make it difficult to latch. If they've had a great breastfeed, they don't need to have anything in their mouth. So it's not going to work well, because why are they sucking? They're not particularly hungry. So often trying a little bit of the breastfeed, maybe 5 minutes, so baby's not starving, they've had a little bit, but you know normally they'd have another 20 minutes of milk. Take the baby off, let's try the formula then, so that you're giving them the best possible chance of being in a happy mood. Different temperature. Some babies will drink cold milk. Some babies need it to be body temperature. Some babies are happy with lukewarm. Try and find out what your baby will take. Try adding movement. If the baby's really not wanting to have a bottle, something that can be very effective is doing this very vigorously with the baby and then introducing the bottle while you're moving. Okay, they're kind of distracted by the movement, and sometimes they can take that easier. That's also a technique you can use if baby's not latching at the breast, used to, but has gone off for a reason, is trying mum moving around and then, oh, look, a breast has gone in your mouth, da-di-da, carry on. So movement, quite a lot of movement can be really useful. So a rocking chair, bouncing, walking around the house. And then from 4 months, if baby's refusing a bottle, try a cup, because there's no need that says you have to have a bottle. Before 4 months, cup feeding, there's a higher risk of aspiration, so we don't want to be feeding large amounts in a cup because of the aspiration risk. That means the milk going into the lungs, not into the stomach. But after 4 months, they can cope a lot better, and so this is something that you can try. And then again, thinking of amounts, this is a really useful slide. It's one of the ones I probably use most in my practice. How much should a baby be having? And this is around infant formula. We start off by thinking about weights and thinking about 150 to 200 millilitres per kilo of baby. But very soon, we then go on to roughly how old they are. And there's a range there because babies differ in size and differ in appetite. But if you've got a baby of a certain age who's having a lot more or a lot less, we need to be querying what's happening. And the link at the bottom is where you can get this from. So we're going to go to an activity, and we weren't going to have pairs, but Maria's not here. So I'm going to ask you to work as a 3, and I'm just going to make an email or a phone call to her to see what's happened, because she hasn't sent anything through that I see. So this is a wonderful photo, isn't it? It's not mine. This is from someone else. It's lovely. And it's showing a load of women feeding in all sorts of different ways and not giving a damn. So can we just identify what different feeding is going on in this room?
Breastfeeding, bottle feeding, formula feeding.
Mm-hmm.
You mean the positions? Or?
Yeah, there's other things in that room as well. See breast pumps?
Yes, the mum in the corner.
Resting as well. So we've got lots and lots of things going on there. Yes. So why might parents choose to formula feed? And then between us, we're going to make a list of pros and cons. So I'm just going to go on mute while you discuss number 1. And that's because I want to phone Maria and see if she's okay.
Okay. So discuss the reasons why parents might decide to combination feed. So it's
might be because of their work.
Because of their work?
Yeah, they decide to go back to work now.
Okay. But in that's if they cannot express enough, is it? If they
I mean, they can express the milk and can feed a baby. No, while they're at work. No, there's the combination of feed, the expressing and
combination is breastfeeding and formula feeding at the same time, right? Yes.
But a mother goes to work maybe after 3 months. She's forced by state, right?
Well, not in every country. I mean, in America, sometimes they go after 6 weeks, or even earlier, some of them. So how about health reasons? If the mom is not producing enough milk, and she would need to
I think if
introduce
that's
formula
the
as well.
PCOS or the thyroid, I think
Yeah, there was PCOS, like PCOS,
I think the
thyroid issues.
combination might not work, I think, because she's got health issues.
But I think she can still breastfeed with those issues. It's just that they um, interfere with the how much breast milk she makes, right? So at least that's what I think. We'll see what Caroline says.
So
But
anyway,
any other reasons?
yeah, I mean, it's very simple, I think. Sorry, don't mean, but
No.
I find difficult. I'm emotional as a new mom. I find difficult to breastfeed. It's not working out. My baby, I think it's starving in my mind. So I'm going to supplement it with
Yes, so
the bottle feeding, I think. So
Not
the
enough support. No.
not having enough of support.
yeah, lack of
Probably
information.
help, professional or family.
Yes, but
Then
you're right that if parents think that the baby is still hungry, then they're more likely to supplement
Yep.
with formula. And probably if they think that the baby will sleep, but I know that's not true, but some parents I've heard them say, my baby will sleep better at night if I feed them formula for the evening feed. Which
Can I have some help from people who are used to international calls? Maria's number starts 035.
no 00. It has to be 00.
0035?
Yeah.
Super, thanks, I'll try that.
So the medical condition, the emotional distress,
Lack of support.
Yes, lack of support is a very important one,
how
isn't
about
it?
the medication? You know, if she's taking the cold and flu medication and she's not producing enough of milk, she turns to the formula feeding. Again, it's all about the information. It's all about the support.
Yes, so that kind of medication, or if she's taken medication that I mean that is
Fast.
recommended that once you take it, you shouldn't breastfeed at the same time as well. And I think there was a webinar about that, and it was like I remember one of them being decongestants, like tablets or liquid. If the mom has taken that,
Right,
then
it
that
wouldn't go through, so I've sent her an email. I'm not good
Okay.
with international phone calls.
Maybe she thinks it's every Monday.
I shouldn't have, but I've sent an email and hopefully she'll respond. Right, I heard most of what you're saying. What? Oh, there's just an email come through. What? I cannot attend the online course. My newborn baby needs me. Parents have to go to a last minute appointment. Okay. I'll just send her an email saying this just came through. So she had emailed me, but it had come through in a different email. There we go. Cool. Right. Are we recording this? Oh gosh, is this recording? Yes, it's recording. Maria, we're recording this for you. I'm ahead of the game. So hello, Maria. Really glad that you have sent an email through, and yeah, hope you catch up with this in your own time. Okay, so I heard most of the reasons why parents might discuss. You had a couple of questions though.
Oh, what was the question?
Something about
mother going to
medication?
work. Oh.
Something about medication or something about PCOS. I thought I heard a question.
Oh yes, the milk
Yes.
production in PCOS or thyroid.
Right, PCOS can be underproduction and it can be overproduction. So that it's not that it's only one thing. It can go both ways. If they have a thyroid issue or reduced glandular tissue, it tends to be reduction. So breastfeeding is possible, but sometimes those women won't achieve a full supply ever, because there's not enough working breast tissue there if there's not enough glandular tissue, or the thyroid is having an impact on because thyroids are hormones. It's stopping the amount of hormones being produced that is needed.
Yeah.
So
So
that's
sometimes
the formula feeding most likely only, yes?
It depends how committed they are.
Okay.
If a woman has that and she has good support, she may be giving her baby a little breast milk. And as we know, each teaspoon having 3 million immune factors, a little is better than nothing, but it is hard work. So it depends, you know, it depends how much support she has, whether she's got toddlers, whether she's got twins, whether a husband or partner's home, whether she's doing this on her own, whether she's got a maternity nurse. So all of those women can generally produce some breast milk. Often it is very, very small amounts.
So I don't know why I thought that the combination feed is basically from the feeding from the breast and then compressing, you know, to put the
Combination feeding is around breast and formula.
Ah, okay.
That's what we mean by the combination, that they're sometimes having breast milk and sometimes having formula. It's not around how it gets in, i.e. bottle or breast. It's about the different the different milk that is there.
We didn't get around to discussing pros and cons.
That's okay. That's what we're going to do together. So what are some positive reasons why combination feeding might really work for some women? Why might it be a good choice for some people?
Well, it gives them a break, the moms, right? If someone else feeds the baby, then mom gets a big break.
And it used to be that you'd get that big break by your sister wet nursing your baby, and then your auntie or your mum. But we don't have that anymore. So combination feeding can step into that role. And
what about giving the chance of someone else to have bonding time with the baby?
Yeah. So although we know bonding isn't the only way you can feed with your baby,
yes,
because or else formula fed mothers would never, you know, bond.
Yep.
It does mean that other parents or grandparents can get involved in another aspect of baby care.
Maybe it suits their lifestyle.
What, sorry?
Suits their lifestyle.
Yeah, so it might it's work for them, particularly if they're going back to work early, or their work environment does not support pumping, or their work, you know, it's not something that they want to spend their time doing, or they've got, this is baby number 5, and you know that. So yes, there are reasons why, absolutely. What might be some negatives that women will have to consider about formula feeding?
Impacts milk supply if
especially
started before the 6 weeks.
Yeah, real biggie, absolutely.
Yeah.
And also the immunological factor of antibodies.
Yeah. And that also think about what's in formula. Formula is safe for babies, but it's not optimal for babies. Formula will never be as good for a baby as breast milk is. So it can be the right choice for a mother, but it's never the optimum for the baby.
And what's about if they don't know about paced bottle feeding and they're just not doing that technique?
So because paced bottle feeding isn't as well known as it could be, it could mean that actually combination feeding derails their breastfeeding journey, that they expected that dad would give a bottle once a day, and actually they end up in 3 weeks time one breastfeed a day. So it can have negative impacts that they weren't expecting. Okay, we are going to talk a little bit now about weaning. And weaning means 2 things. It means finishing breastfeeding. So we can talk about weaning as in the time when a woman finishes breastfeeding. It also means introducing solid food, which we call complementary feeding, feeding things as well as breast milk or formula milk. So for this seminar, we're going to talk about weaning to mean introducing solid foods. But just be aware that some women, when they say weaning, mean the time when I stop breastfeeding. And we often say night weaning. So the time when I stop breastfeeding during the night. So the most recent advice about introducing solids at or around 6 months has been UK guidance from 2003. So that's 18 years. But the 4 months is strong in our memory. And actually, it was never 4 months. It was 4 to 6 months. So when my 18-year-old was a baby in 2002, just before this changed, the guidance was introduce solid food at 4 to 6 months. But the to 6 bit was never heard, and everybody started at 4 months. And that's one of the reasons why the guidance has changed. Because actually we know about the science has changed, but also the to 6 bit never got through as a message. And sometimes with public health messaging, you have to be a lot more clear. I mean, we've seen this in the UK we had a really clear message at first for COVID, which was save the NHS, stay at home. And I know what to do. If I'm told to stay at home, it means stay at home, right?
Yeah.
But when the message was save the NHS, stay alert, well, what does being alert look like? You know, does that mean I can go out or I can't? Does that mean I should do this or I shouldn't? It wasn't a clear enough message. And 4 to 6 months wasn't clear because no one then waited until the 6 months because, well, 4 must be okay, earlier must be better. Often you will hear, and again on maternity nurse forums, people going, well, my consultant paediatrician says that they're going to change it back to 4 months soon. That's not correct. The people who give the guidance, the World Health Organization and in the UK UNICEF, state annually that they are not changing it at the moment. If in the future the science changes, they might, but at the moment it's very clear science that around 6 months is best. And if we look over history, and this is a bit of a small graph, the age of the baby in months goes up the side, and that top one is 11 months.
Whoa.
And then the year goes along the bottom. So in 1880, most babies had their first solid foods around 11 months. In the 1920s, about 6 months. In the 1930s, about 4 months. In the 1950s, 4 to 6 weeks. And then we were on an upwards path until 2020, and actually it was 2003 when we said around 6 months. So it's a lot changed over time, hasn't it?
Yes.
Incredible.
So when people say, well, it's like, well, that's nice, but that's just one period in history. It's not that 4 to 6 months was always the case, as people often seem to portray it, that was always what we did, and this is just a new thing for 6 months. Actually, you go back long enough, and you're back to 6 months or more. And if we think about how humans evolved,
I was going to say, there is a reason behind a child needing mother's milk, because the baby itself cannot be fed on its own. When do the teeth grow completely? I mean, they cannot masticate just
absolutely. Teeth have not a lot to do with the mastication of the food. So having teeth is not an indicator for weaning because the gums do the work. So although babies often have teeth from between 4 and 9 months and then keep going with more teeth doesn't have a lot to do with early eating.
Okay.
Because you've got teeth in front.
Yeah,
But
they come here first, which is cutting. But
yeah, cutting.
Elena?
Caroline, how come it was as low as 4 weeks in 1950? What happened there?
Infant formula manufacturers became a big thing. Mm-hmm. Money happened.
Money. Horrible.
And infant formula and then infant baby foods. Baby foods manufacturing, canning processes and so forth after the war really ramped up. We had much more processed food after the war.
Yeah.
And as well as that processed food for adults came processed food for children. And people wanted to sell stuff. The earlier you sell it, the more you sell, right?
Well, people do for money. It's crazy.
So it's the same with cigarettes, isn't it? Who doesn't have to remember cigarette advertising?
Yes, they advertise healthy habits.
The earlier you get them.
Yeah.
Always the profit over the people.
Absolutely.
So what did you want to say about the evolutionary process?
I was saying, let's think about cave baby.
Yeah.
So what would cave baby have eaten? Is puree an option for cave baby? Do you think cave mummy sat over her fire, squashing things and making them? No, chew and give them to the baby. Yeah, chew it a bit, give it to the baby. That'll be fine. So what's the likelihood of the mum doing that at 4 to 6 months before baby can swallow bits of food?
None.
Not a lot, because so the baby has evolved to be, you know, same as cave baby, when they're able to do this, pick up the food and put it in their mouth, and do something gummy with it and swallow it down, they're about right for eating, because that's what we'd have given them. You know, masticate some food, give it to the baby, they'd have picked it up, put it in their mouth, gummed it and swallowed it. So purees is basically a fairly recent invention to get food into babies earlier, because when we thought our babies needed food earlier, the only way we could do it was with mushy stuff, very like milk, because that's all babies are biologically expecting to have, is drinking milk. So we needed to make something more like soup than cereal, so that babies could actually take it down, because at 4 or 5 months, they cannot deal with anything else.
So do they introduce the mushy food because of the conveniency of it? Or like they want to wean the baby off too soon to have the job done? And
well, it's not convenient in the sense of anything is more difficult than breastfeeding. But if you think that if we think that babies need food earlier, the only food that they can take down is sloppy food. So purees were invented because we thought we needed to feed babies at 4 months or so, and the only thing that they can take down is effectively a liquid. Jana.
So why would the mother, intelligent enough, for example, knowing all this, you know, seeing the graph, still choose for her baby to progress fast?
So say that one again.
Why would the mother, you know, I don't want to say intelligent enough, I don't find the correct words, maybe even seeing this graph, still want to progress with, you know, the feeding, to start to feed the baby fast and or too early? Why would she still want to do it?
Because generally our society favours early. It likes people to do things as soon as possible. It celebrates, my baby's walking already, my baby's talking already, my baby's eating already.
Society.
So it's about early being a good thing. And people want to get on to the next stage. They're not enjoying the stage, not that they're not enjoying the stage that, but they're always looking what's next, what's next, what's next, and that's quite a societal. There are other things like pressure from families. Well, you had food at 4 months, why aren't you feeding that baby? That baby must be hungry. Baby's crying, must be hungry. No, it doesn't need a breastfeed, it needs solid food. You had solid food at 4 months and you slept right through. So the pressure from people you know, saying this is how we used to do it and it worked for us, but memories are very bad.
Okay.
I just wanted to mention something. I've got, through my experience, usually the mothers chose their babies to feed at 4 months with the puree, and then introduce the finger food at, I don't know, maybe 5-6 months. You think it's better just to stay with the milk until 6 months and then start with the puree, mash, and...
Well, let's go on to that in the next few slides. Yeah.
Okay, thank you.
Okay, so why 6 months? So thank you, Jana, because you perfectly got us into why 6 months. So the UK, and this is a report you can look up, had another revisiting of this in 2018. And they looked and they said at 6 months, infants are developmentally ready to accept foods other than milk. Their tummies are ready, their guts are ready, their mouths are ready, their throats are ready, their coordination's ready. So around 6 months is when children are developmentally ready. Before then, they weren't developmentally ready to accept food. So we had to mush it up. We had to puree it because that's the only way we could get it down. We know that introducing solids before around 6 months reduces the amount of breast milk. If you're going to give your baby some pureed carrot, that's a bit of breast milk they're not having because their tummy is a finite size. And the less breast milk, the more association with illness. So it reduces breastfeeding. The idea that if you didn't start between 4 and 6 months, which is what scientists believed about 30, 40 years ago, has simply not been proven to be true. We thought that, and then we tested it, and then we found out it's not correct. We also thought that we needed to give them food earlier because their iron stores would be too low. But actually, Most recent research shows that their iron stores are sufficient for around 6 months, not around 4 months. And where this is from, again, there's a link at the bottom of the page. And so around 6 months, actually, what it means is not on 6 months, the birthday of 6 months. It means maybe a week before, maybe 2, or a week or 2 or 3 after. What it doesn't mean is a month before or 2 months before. So that's what they're meaning by around 6 months. And these are reasons, to answer your questions, why babies might wean early. So my baby is interested in food, so I'm giving them some food because they're interested. But interest isn't a sign of readiness to wean. And healthy babies are interested in lots of things. Some things are hot and some things are shiny and some things are our cat's tail. It doesn't mean we're going to allow the baby to put them in the mouth. But parents forget that. And they're like, well, it's interested in food, so I should give them the food. But they wouldn't give them the cat's tail to eat, and they're interested in that. Thinking that their baby is hungry. And so they think their baby's hungry, so they give them carrot. Who here's been on a diet? You can have A, salad, or B, full fat milk.
Well, of course, salad, because it's less calorie dense.
Yeah. So if your baby's hungry, give them more of that full fat breast milk or first infant formula, because the pureed carrot is going to be smaller in calories, lower in calories than anything you're going to be feeding from the milk. So if they're hungry, the answer is more milk. Rice, you mix rice in with the milk, that's not adding more calories than that quantity of milk. So saying my mum weaned me at 3 or 4 months and guidance changes. Fine, she did that. We also put babies to sleep on their backs now because the science has moved on. We know now that it's healthier. So you did fine, but it's healthier to do it around 6 months. It helps babies sleep. In a recent research study, and that's linked at the bottom from the NHS, it was touted in the newspapers as early weaning helps babies to sleep. For a start, the study wasn't about helping babies sleep. The study was about allergies. So its study was on something completely different. And they found, as well as their information on allergies, they found that in 3 months, when they weaned these babies because of allergies early, the baby slept an average of 17 minutes longer a night. Wow. At 6 months. So they started weaning at 3 months, and by 6 months, they had 17 extra minutes a night. Gosh. And then after that, the difference reduced. So that's a very tiny plus point for what we know is actually a significant minus. That introducing foods into the gut too early puts babies at risk of many issues, obesity, digestive issues, allergy. So there are lots of negatives for a very, very tiny positive.
But Caroline, is it really, how many babies were studied in this last one?
Ooh, I would have to go back and look. I cannot remember that offhand.
Because if it's less than, I mean, even 10,000, then how is that not just a fluke?
No, it wasn't a large cohort study.
But it could just be a coincidence that they slept longer.
Well, what we do when we do these scientific tests is we look at the amount of the sample size and we do a statistic. Have you got a master's or anything?
No.
Okay, so if you do a higher degree, you would go through a statistical analysis training where you look at the numbers and you basically put it through formulae that will tell you whether it is more likely to be chance or more likely to be a relationship.
Okay.
So you don't need tens of thousands of people to say that there is a relationship.
All right.
Because the maths tells you that there is more likely, that it's 95% likely to be a relationship and only 5% likely to be chance. And that's generally the standard that is used, 5% chance.
Mm-hmm. Thank you.
And generally these studies, again, they build over time. It's not just one, but it's, one study that then leads to another study, and that body of evidence shows us the answers.
Mm-hmm.
So that's why parents might wean, but this is when they should be weaning. We're going to have them stay in a sitting position and hold their head steady. So they might need a little bit of support around the bottom and the hips, but they can mostly keep themselves upright and hold their head. They can do the banana test. If you put a finger of banana in front of them, they can grab it and get it to their mouth, and some of it goes down. They can swallow their food. If the baby isn't ready, they gag. The baby's gag reflexes are further forward than us anyway, so they push food out easier. If they're not ready, they'll push that food out, which is why when we do early weaning, we do it onto puree, because it needs to be as much like breast milk as possible, because they're basically, we're making them a food soup that they can glug, glug, glug down. That's why we don't want to wean until they're ready, and then they can have the solid food. So things that parents think might mean their baby's ready. Chewing their fists. Developmental. It happens from around 4 months. It's completely normal. It's got nothing to do with being hungry. It's about exploration. It's about that feelings that they're having. It's nothing to do with hunger. Waking in the night when they've previously slept through doesn't mean that they're waking and they need food. They may be hungry, so we give them more milk. It may just be a developmental change because sleep doesn't go perfect like this. It goes, woo, it gets different. Woo, it gets different all the way through that first year. We have things that go better, things that go worse. Wanting extra milk feeds because, yep, they're normal, they're growing, that's fine. Give them more milk feeds, that's more calorific.
Caroline, so our 15-month-old baby, it's completely weaned off. It's eating beautifully, everything. But my boss is saying how long she should formula feed, where she needs to discontinue the bottle. And I did not have educated on the intuitive or logical.
In the UK, it's very clear. In the UK, we advise formula feeding parents to switch to plain cow's milk from 12 months old. So a while ago, there's no need for formula at her age. She can have cow's milk from 12 months.
And then that cow's milk, how long would you be actually giving the baby a bottle, whether it's a formula or cow's milk? You know,
she's actually an actual bottle in the UK. We suggest that babies come off bottles by about 12 months. So we're introducing a cup in the second half of the year. So between 6 and 12 months, we're getting that baby used to a cup, and by 12 months, we're off the bottle, and that's for dental and speech reasons. So at 15 months, soon as possible for both of those.
But lots of parents still continue with the bottles with the night evening feeds.
They do, absolutely. That's generally the last one to go because we know babies like to suck. And unfortunately, when most babies of 12 months plus have teeth, what would your dentist tell you as an adult if you were having a milky drink at night and not brushing your teeth afterwards? So we have something that's very high in sugar, sucking through a bottle, which we know swirls the milk around the mouth. And then we're going to sleep on it or just after it. So there's no teeth brushing after it. The worst thing you can do for teeth is a bottle late at night. So it is absolutely true. It's the last one to go for many people because it's very comforting for the baby. But for their health and dental development, it's really bad. Parents have to make the decision, don't they? Not us, parents. How do they want to weigh that? It's their child. They make that choice. But guidance.
How about giving them sorry. What are the guidance of giving a milk after 12 months in a cap to a baby? How long are there any guidance for that?
In a cup.
The cow's milk in a cup now. Then what are
that we generally expect children to have milk in the UK up to and through childhood. We know that globally, drinking cow's milk, drinking the milk of another species is really weird. It's not something that human bodies were meant to do. And some ethnicities have a higher proportion of adults with lactose intolerance, and they're often societies where cows were less of a thing. You know, they just haven't had that historic exposure to cow's milk over time. So the idea of giving a human cow's milk is weird in biological nutritional terms. If we go back to cave baby would have had breast milk until between 4 and 7 years, and then would have gone on solid food and no milk in that diet. So if we think about that, into mid-childhood, although culturally we continue to have milk as a drink much later than that. You know, we put it in tea and various other things. So certainly cow's milk in the UK for the first 5 years. But it then becomes a cultural thing, whether that's continued or not.
And it's purely based on the understanding of the nutritional value, yes? Like calcium.
Yes, cow's milk is high in calcium, absolutely. So there are other ways to get that calcium.
Oh, absolutely, yes.
Yeah, so after 5 years, we're then saying, well, how else can we supplement that diet? But many people continue to have milk as a drink. You might be going on to cheeses, yogurts, all sorts of things as well. So that's very personal preference. So looking at weaning, keep an eye on the time. How many slides have we got to go? Oh, quite a few. Okay. So safety guidelines. So when parents are choosing to wean early, so they might be making that choice. You may or may not agree with it, but frankly, it's not your baby. So they might make that choice. If they have made that choice, it is important to avoid those things on the list, because those babies weaning earlier than 6 months are at greater risk of developing allergies. So we're avoiding foods that tend to have allergens in before 6 months. When babies are weaning under guidelines, so they're around 6 months old when they start, we don't need to worry about that first list. They can have wheat, they can have eggs, they can have fish, they can have nuts that are ground up, not whole nuts. They can have dairy, all of those things, that's fine. But if they're under 12 months old, so the first 6 months of weaning, we are going to avoid honey. That is because there is a risk of botulism. Is anyone here? No one here is Greek, are they?
I know about.
Tell me about Greek and honey and pediatricians.
It was recommended as a medication.
Yeah, so some countries recommend honey for babies for various reasons, for constipation, for this sort of thing. And in the UK, we're very clear. Honey carries a risk of botulism. It should not be given. That infant stomach is not mature enough to cope with that disease. Whole nuts, and that's a choking risk. So it's not about allergy, it's about swallowing them and getting stuck. So ground nuts can be fine. Raw shellfish. Doesn't sound like a good idea, does it? You know, we know that in raw shellfish there are high risks of infection. So, you take your pick as an adult. We don't do that as a pregnant woman, and we don't do that for babies. Same thing, soft or unpasteurized cheese, the same as for pregnant women. We've got a population who is more at risk of getting ill. Liver more than once a week. It has too much vitamin A in it to have. So more than once a week means you're risking too high vitamin A levels. Shouldn't have cow's milk as a drink. It's not appropriate. It can be within cereal. So you can put Weetabix in the milk and give it to a baby, but we're not having it as a drink, because their drink needs to be breast milk or first infant formula, which are formulated to give the baby the right balance of nutrients and calories. Because plain cow's milk is for baby cows. We don't want those to have added salt or sugar. Preferably, we don't want to add that for a very long time, but certainly not in the first 12 months. And I don't know how many families you come across. I've never come across this, swordfish, marlin or shark, but for some cultures, that is a normal foodstuff. And there are dangers. I think it's, no, I can't remember. There's something, it's mercury, I think it's mercury. They're very high in mercury.
Most fish it is actually.
Yeah, so that's what we would avoid. Gluten, before 6 months, yes, avoid. But we're hoping the baby will wean around 6 months, so it's not a problem to wean to gluten, even if there's a gluten intolerance in the family. Of course, if there is an intolerance in the family, you're going to be suggesting that they're going to get health visitor advice. Safety first, peel skins, including if you're giving sausages, peel the skin, because or else you're making a little circular thing in a tube that can get stuck. Removing bones, obviously, from meat and fish, cutting hard food into finger size, like that sort of portion. So if it gets stuck down there, it's not going to be so wide that it blocks the whole of the airway. Baby quite near to where I was working choked on a piece of apple and died. They were given an apple quarter, gummed off a bit. I didn't even have teeth, I don't think. Gummed off a bit, ended up in a chunk, stuck in the throat, suffocated. So we're going to make sure that hard foods, as when we start, are going to be softened. So we're not going to start with raw apple. We're going to steam it a little bit so it softens. When the child gets a bit older, maybe 10, 11 months, we might well be giving them raw apple, but we're going to have finger-sized chunks. So if it did go down, it's going to be too small to get stuck. And any small foods, grapes, cherry tomatoes, popcorn. Popcorn's a big one. If it's that shape, it's windpipe shape. The gag reflex is further forward. So babies are programmed to go, which is very scary, but very good for them. What we're avoiding is babies going quiet and blue. Noisy and red is less of a worry. But if the babies are, a mum's concerned, send them on a first aid course, and we recommend that all of you do a first aid course. So if you do have a baby choking, you know exactly what you should be doing. But I'm not giving you a first aid course because I do not have that training as a trainer. Okay, so foods to start. So there is no rule about what you have to start with. If you're starting at 6 months, you can start with steak. Start with what you want, because at 6 months, they're ready to have different types of food. Often, families start with vegetables. We used to start with fruits, but we're now trying to avoid those sweet tastes first. So often families start with vegetables, but they don't have to. You can start with toast. These are 3 options. You can have a smooth puree, you can mash food, or you can give finger food. From 6 months, you can do all of these. It's not necessary to start with purees, because remember, purees were for those babies when they weren't old enough for food. So we had to do something to get it down them. But if a parent wants to use it, they can choose to use it. What we want is them to be moving on to squished and mashed and finger foods very quickly. Having purees for more than a few weeks is going to actually impact on the baby's receptiveness to having different textures in their mouths. So if mum wants to start on purees, fine, but let's quickly go to mash and quickly then go to finger food. But you can start straight with finger food at 6 months. You don't have to do any of the mashing or pureeing. You may well do a bit of steaming. We don't want to give them hard food. We're not going to give them a carrot that's raw at 6 months, because that's going to, stick and choke and they can't masticate it. So we are going to soften food, but we don't have to mash it. So you can start with anything. You can try vegetables and you can bake them, peel them, don't peel them, cut them into finger-shaped pieces. Asparagus, carrots, beans, courgette. I'm just listing vegetables. There are other vegetables. You can start with fruits. We do think, do we want to start the baby off with a sweet taste? They've been having sweet breast milk though, so there's no absolute yes or no here. It can be that if you start with the weird things first, like broccoli, they tend to accept them longer, they're easier than if they've only been accepting sweet foods. You can have dairy, you can use full fat milk in cooking, they can have pasta, toast. All of these things are absolutely fine to start with for babies. They don't have to do carrots on day 1 or carrots for week 1. Day 2, we have a new food. Day 3, we have a new food, but we're only doing vegetables for 2 weeks. There is no science to say that that's how you have to do it. So we're just looking at the safety, and we're looking at how much can they actually chew, because they won't have many teeth, so they use their gums to chew. So we're going to make sure that these foods are soft and easily malleable. They're going to fall apart easily in the mouth. That means the baby can swallow them down and they're not going to choke. Eggs are great. So mash up the egg, or scramble eggs, lovely, or cut lengthways if you've boiled an egg. Babies can start with meat. And actually, if we're introducing food, because we know that babies' iron stores are starting to lessen, well, what foods contain lots of iron?
It's red meat.
Meats. So obviously we're not going to give them a steak and a knife and fork. We will need to really well cook these meats so they're really soft. We're going to pull them apart like pulled pork, like that, sort of pulled chicken, that sort of thing, so they're easier to get in. But you can start with those. There's no reason to say you have to start with, avocado or carrot. Stages. So we used to think that we needed to move babies through stages. We had purees at this age, and then we had lumps, and then we had mash, and then we had finger food. And commercial baby foods, things from the shops, generally have age ranges on them, and they go through that thin purees, thick purees, mashed lumps, and they go through very slowly. Because is it in a baby foods company's interest to say, you can buy my food, or you can just put your own food in front of the baby and see how they do? It's in their interest to make it a long, drawn out process, and for babies not to be eating family foods cut into fingers or, pulled apart early, because then they're not going to sell any baby food. So they are marketed from 4 to 6 months, despite the guidelines being from 6 months. Remember, if it's not an absolute law, the companies will get round it. Same thing with that follow-on formula that is not needed. Yeah. They can say 4 to 6 months, even though the guidelines are around 6 months. If your parents do choose to start with purees, just to reiterate, move quickly from those thin purees. Just because the thing on the packet says suitable from 9 months, that's just because the companies are trying to make you move through it slowly. If a baby can have finger food at 6 months, which it can have a jar for 9-month-olds, because that's a false progression.
I've got the experience for children that used to have pure food. They just didn't want to eat solid food.
Yeah.
They just wanted to have everything.
And the interview I did with Jill Rapley that I put up today is very interesting on this point. And she said, when babies are fed these purees, it's just some gunk on a plate. And they don't know whether that orange gunk is going to be carrot or mango, she said. So it doesn't help babies to get control and to know what's coming when you're getting a plate of orange and you don't know what it's going to be. It's a bit like if I served you a dish and you didn't know whether it was risotto or rice pudding, you didn't know whether it was your main course or your dessert, it's going to be a bit weird. So we have these foods and they're kind of they're a mush, they're a green mush or an orange mush, and that's what they're used to having in their mouths, so they don't then get used to having what food looks like and feels like, and that idea that mushrooms feel different to apple, feels different to avocado. So the earlier we can get them off these purees or not having them at all, generally the better for their overall development. And unless a health professional has told you, because maybe baby has a strong family history of allergy, there is no need to do one food at a time. They can just eat whatever from day one. If the family had loads of allergies in their family, a health professional is going to say, let's really track and make diaries and look at symptoms. But that's a very small amount of the babies that we're going to talk about. So baby-led and traditional. So traditional weaning means a puree on a spoon and the parent in control, and then mashes on a spoon and the parent in control. Baby-led weaning, she'll go through it much more in the webinar, but basically it refers to offering baby family foods in whole pieces or cut up to safety chunks and helping the baby to feed themselves, not the parent being in control, going more, saying, this is your food, have it, don't have it. And also having family meals, the fact that baby eats at the same time as the family, not we feed baby the puree and then we go and have our meal. So both approaches have plus points. There isn't any research to say one is definitely better and one is definitely worse. But we do know these things. And Jill goes over this in her webinar. Baby-led weaning. Weaning babies onto solid food does not lead to higher choking risks. In fact, she says there is a thinking that actually they could be better at handling choking and less likely to choke because from an earlier age, they've learned what to do with things in their mouths, rather than being an older baby that's then suddenly got to work out what to do with these lumps. Things like fussiness and obesity, the evidence is mixed. It's not clear. They do have an innate preference for sweet, so it might benefit them to start with savoury. There are no real long-term studies of this though. And if you do traditional weaning, let's get through purees within the first 6 weeks, get on to mash and real food. And if again you're doing traditional weaning, we need finger foods in there by 9 months so that they're getting to hold and put things in their mouths, and baby eating the same as their parents by 9 to 11 months. And they don't need teeth because they're using their gums. Teeth is a bite, comes later. It actually doesn't affect what they're eating. So just a tiny bit on commercial foods. Homemade is best. We know that from our own cooking, right? But when it comes to baby food, it's even more important because companies are just out there to make money. So most products are fruit only. Do we think that giving babies mostly fruit, those sweet taste, is a great idea? Probably not. And 65% of the baby food products out there that have vegetables in them, the vegetable is that sweet carrot or sweet potato. So it's not a bigger variety as you would have at the family table or homemade food. For some manufacturers, and this is quite a recent study that's come out, they looked at what the label said and what was in the packet. And you might read, oh, brilliant, this puree is broccoli, peas and pears. Oh, that's good, because I do know that it's important to give baby those savoury flavours first. Broccoli, yeah, that's really good. I want to give broccoli to my baby. Excellent. And when you look at the actual ingredients, it's 79% pears. So is it doing what the mum thinks it's doing, giving her baby that broccoli taste? No, broccoli's 7%. This does not taste of broccoli. Mighty grains, because we know we want our baby to have superfood. Grains are good. It's all in the ether at the moment. It's all about grains. Actually, 3% was quinoa flour. Is that how you say it? Quinoa?
Quinoa, yes.
Thank you.
Quinoa, yeah. Different people say it different ways, but it's okay.
I was about 20, no, I was about 41, 42 when I learned it wasn't quinoa, but hey ho. It's not something that I eat, but it's a thing at the moment. Quinoa is a thing, it's a healthy thing. So let's put grains at the front. It's 3%. Actually, you're giving your baby an apple. Even though it says mighty grain, squash and apple's the last bit, it's a pouch of an apple.
Yeah.
So if you think that you gave your baby broccoli for their lunch, and then grain, squash and apple for their dinner, what they've actually had is some pear and some apple today. That's not very varied, is it?
No.
And then the same thing, strawberry, banana, raspberry and apple. The apple was 79%. So basically a lot of these foods, you're fundamentally giving them loads of apples, pears and carrots.
Because they're the cheapest.
Because they are the cheapest. So even if you think broccoli, pears and peas is a good idea, it seems weird to me, but hey ho. This is the difference between coming out of a packet and making it yourself.
Ugh.
Different color.
Different color.
Different texture.
Different amount of broccoli. Now I've made this of broccoli because I thought that I was going to give my kid broccoli. So it's mostly broccoli, 50%. This is mostly pear, but it's 37p to buy that and 15p to make this 40 grams worth. We used to add rice and oats and things. Now we add spelt and quinoa because they're healthy and all the yoga mums like it. It's marketable. But they're added as flour. So we don't know, even if the health products that we think are good for us, like these, spelt and quinoa, which we reckon are probably maybe good for the adults, that's in their whole food form, isn't it? But when we mash the grains up into flour, we lose the fibre. There's loads of processing, so we don't even know if it's a good thing for the baby now. And they're only tiny quantities anyway. So it's just getting on a marketing spiel here. And just 1 pouch of baby food a day can, for some of the pouches, result in the children meeting or exceeding all of their free sugar example for the day. They're very, very sugary.
I bet most parents don't even know that.
Nope, they do. This is
Adults kitchen is
why
quite.
would marketing tell them? And then the average cost is ridiculous. A £1.10 for a pouch of food compared to 14p making your own.
Wow.
So the pouches are just bloody awful. The pouches are probably just the worst, because the pouches are awful for the environment. You squeeze them out, but just as gunk, is green gunk. There's very little texture to it. It's mostly water. You can see that. It's just slop. And then you get the older children just eating them out of the pouches. It's not good for any of their development. So a couple more minutes. Yeah. Advantages of homemade: less sugar, less preparation, less processing. They don't concentrate the sugars in the same way. It says highly processed fruit and vegetable purees are high in added sugars because the sugars, biology, have been fully liberated from the cell walls. Basically, the processing that they have to go through frees all of the sugar. Whereas if you mash your own fruit and veg, it just doesn't go through that same process. So the sugars aren't seen, they're not concentrated in the same way. Taste and colour being authentic. It's actually what it really looks like. Lower cost, even with mashing organic carrots, 70 grams would be 14p, whereas the carrots from Ella's Kitchen is 90p for this. It's not the same, but for the same amount of food. You can change the consistency, so you can get that thicker food quicker, mashed food quicker, or soft. You can just offer it soft. And minimum waste, because you're not looking at a whole packet and thinking that's how much my baby should eat. Oh gosh, they've only eaten half. And then overfeeding your baby because you assume that packet is the right amount for your baby. They learn to eat at the same time as the family. They learn what food looks like, what it smells like. And they learn their table manners with the family, and the waste packaging is minimal. So quick, 2 slides quickly. Weaning tips. Cheap high chair. IKEA do a really good one because you can take it all apart, including the legs, and dishwash it. So you can put the high chair in the dishwasher. Honestly, it's brilliant. Saves time.
And it's about £15, isn't it?
Yeah, putting it in the dishwasher is amazing. When you're feeding finger foods, family foods, chips. Think chips. Don't give your baby lots of chips, but think of a chip, because what the baby can do is grab it and put some in their mouth. Because if they grab something that's too small, what they can't do at 6 months is open their fist to put it in their mouth. Once they've grabbed it, they need like a bit sticking out, and they'll gnaw on it, and the bit in the hand they won't be able to eat. It comes later that they can take it out of their hand and eat it. Crinkle cut food can be easy, so invest in a crinkle cutter. It kind of looks cool, but it's actually easy to pick up the food. When they start to do their pincer grip, this thing, then you can introduce bits of sweet corn type foods, sweet corn peas like that for them to pick up. It's great fun. If you avoid adding stocks and salts to the family food, basically baby can eat what you eat. So cutting down on the different types of meal preparation, not having to whiz them through those silly little steamers and blenders and things. They eat what the family eats. And it helps parents to eat more healthily because they're thinking about what their baby's going to be eating. Bowls, why put food in a bowl? Because all the baby's going to do is to throw the bowl.
Yeah.
You've got a high chair. If you're in a high chair, put it, wipe the thing, put it on there. And then they have bowls that stick down.
Yeah,
they can still be thrown across the room. It's just why I don't get bowls. If it's warm enough, put the baby in the nappy. Why have another change of washing? If it's not warm, have one of those bibs that goes like down to here and up to here and down to there, and then you just take off the bib and wash that. And especially with twins, you need to do this. Put a white clean tablecloth underneath the high chair, and if you wiped it before you feed the meal, if it's baby-led weaning, just pick it up and give it back to them. Pick it up and give it back to them. Obviously at the end of the meal, do throw that away, or get a dog. Just go underneath and eat it all. The more time you take into preparing the food, the less your baby will eat. That's just a rule. That's not science, but it feels like the more that the parent is like, well, I bought the organic food and then I steamed it in the special steamer and then I blended it in the little baby blender. I don't eat it. Give the kid what you're eating, they'll generally eat it. And then get the camera out. because it's great fun.
Caroline, can I just ask, at what stage can they open the palm?
This comes maybe between 7 and 9 months. It depends on the baby. But at 6 months, they can just do that. They can't then, they can open their hands, but they can't coordinate.
Yes.
I have food in my hand, so I should open it.
Yes.
That bit isn't in place. So, 8, 9 months, maybe a bit later. So they can do this, but just not think it through.
Eating,
There's
yeah.
food in there. So food with handles. And then we were going to do an activity, but it's 5 past, so we won't. So think in your own heads afterwards and watch Jill Rapley's webinar. And this is, oh God, what was his name? I remember the birth and I'm desperate to remember the name now. Mum is Claire, Dad is Richard. It's an unusual name, that'll come back to me, sorry. But can you see him having his family food? So they've all got peppers and some mozzarella and some bread, or some sort of bread or toast. And they're all eating exactly the same. And he's maybe, what is he there, about 11 months old there.
Oh.
So he's sitting at the table, they're having their family meal. So if we would, we'd have decided pros and cons for traditional and baby-led, but watch the webinar and that covers it as well.
Thank you very much.
Right,
Thanks,
okay,
Caroline.
only 5 minutes late. That's not so
No.
bad for me, is it? Great stuff. Right, I will see you guys on Monday, hopefully back with my books. I'll be happy if I'm back with my books.
Super. Wonderful.
Yes, exactly.
Lovely. And remember, homework this week is watch the videos, read through the documentation. And the documentation for this lesson is some weaning guidance. And there's also a booklet on tongue tie. It's not something we've covered today, but it was kind of with we're talking about boobs a bit earlier. So we were looking at reasons why baby may not feed effectively. That's why you've got an information booklet on tongue tie. Okay, I will see you all on Monday. Have a great weekend.
Thank you.
Great evening and a
Bye-bye.
Bye-bye.
Bye.